Good evening, all. I don't know whether we are in the same time zone, but in Kenya, it's evening. So happy to be here and to take you through this session on monitoring and evaluation, but giving it a finance aspect. So we'll start by maybe introductions, but success, how many people are we expecting so that I just know when to kick off?
Let's say it like 10
Like 10.
people would come in, at least enough for you to kick off. They usually join much later, as
Okay, fine. Yeah. So in the meantime, since others have already joined, we can start by the introduction. I'll introduce myself for successfully introduce, but I just want to know who these are. So we can start on Esai. You can introduce yourself, what you're doing, if you have a grant, what it's all about, where are you in the implementation, and then we go to pressures, and then we go to Tatiana. And if you
Okay,
can the
thank you.
camera, I'll be
Sorry
so
for
happy
the.
to see you.
Okay, I'll just put on my video for a few seconds. Apologize for the background noise.
And let me stop sharing so that we can have a better view.
Okay, this is me. This is Vanessa. Okay, so so my name is Dr. Onesai Chiguare. So I'm a medical doctor. I come from Zimbabwe, and I currently work in a health insurance company. We call it Medical Aid here in Zimbabwe, under managed care. So I help the business with cost containment and as well as managing people with chronic diseases, hypertension, diabetes, cancers, given my background. And then I also do a bit of risk management. So I do fraud, waste, and abuse investigations, just making sure that, the claims that come through are of the highest quality. There's no waste, there's no abuse. So quality assurance, and then just also trying to ensure that, we are not ripped off as a business, because that also happens within the health insurance space. And then I have a seed grant from Walls Mountain Initiative, in which I'm implementing training primary healthcare workers to administer basic infertility treatment and care. So trying to take back infertility to the grassroots level, so that more people have access to those services, because a lot of my people within the rural population and within the primary care setting find it very difficult to then access services within a tertiary facility, but that's where most of the specialists are, who are the ones who treat them. So right now, my project is still at the stage of implementation. I would say phase one. We're really getting approvals. So far, we've gotten approvals from the Ministry of Health to then conduct a pilot project within one of the provinces in Zimbabwe. And then hopefully with the results, Ministry has then given approval for us to then scale it up to the rest of the country. So they've also given us an implementation partner, which is the National Institute of Health Research. So it's sort of then doing a research sort of. One of the other things that I forgot to mention is that I also have an MBA, did an MBA, also did health economics as a master's, and then also did a master's in sexual and reproductive medicine. So with that background and the work that I do, I'm really interested in health financing and health system strengthening, hence the reason why I'm embarking on this project. And at the moment now, we are getting approval from the Medical Research Council of Zimbabwe so that we can conduct our project. We have already started engagements with the medical directorates of the various provinces, as well as the clinical directors and so forth. So yeah, That's me in a nutshell. If I continue, I would take up
Yeah.
a lot of the time, but thank you.
Yeah, thanks for the very long introduction, but I get clearly what you're doing and where you are and even your educational background. Thank you for that. So I'll request the others, as I'd mentioned the names, to just say it briefly, maybe 2 sentences. But the part I'm also so much interested is where you are in your grant in terms of the implementation. I think I'd mentioned Tatiana and Precious. I don't know who was coming before whom. Precious, are you able to speak now that I can see Tatiana is chatting? And then we can go to Isabel. I think Isabel, you okay? And then Catherine, and then Supat. Success, you can hear me?
Hi everyone. I'm
Good.
sorry, unfortunately I'm on the road. I
Oh
think
my.
it's
All right, but I hope you'll be able to just get us and you'll be able to be part of us in terms of hearing, participating, and safety first on the road.
yes, I will.
So just tell us a sentence about your grant. Okay, you can chat if you are not the driver. Okay, we can go to Catherine, Isabel, and then Supat. Success, you can confirm for me whether we are all together.
Yeah, I can hear you. Maybe they're a bit shy to share. Isabella, I see you've unmuted. Can you introduce yourself? Hi, Isabella. Oh, I think they're a bit shy. Would you want me to introduce you now? Like read out your
Yes,
bio?
please. Yeah, yes, yeah, because the time is not on our side.
Okay. All right. Thank you so much, Elizabeth. It was so interesting to hear the work you're doing, Dr. Nizai, and I'm really excited to learn more about it after now. So thank you, Elizabeth, for accepting our invitation. So I'd read out your bio, even though I know that you are very approachable than how this bio is so serious, but it shows like how much work you've done in the field of finance and what we are looking forward to learn from this session. So Prof. Elizabeth Kalunda is the chairperson of the Institute of Certified Public Accountants of Kenya, where she provides strategic leadership in shaping the future of the accounting profession. As a certified public accountant of Kenya, she brings an extensive experience in accounting, financial management, and governance. She also serves as the director of Lofty Coban Investments Limited, where she leverages her expertise to guide investment strategy, enhance corporate governance, and support sustainable business growth. In academia, Prof. Kalunda is an associate professor at the United States International University, Africa in Kenya, where she teaches and mentors students in accounting and finance. She also holds a PhD in business administration from the University of Nairobi, specializing in banking, and is also a certified professional mediator, a role that also strengthens her ability to navigate complex decision-making and resolve conflicts effectively. Professor Kalunda is passionate about empowering women and the next generation of finance professionals through education, mentorship, and thought leadership in accounting and finance. Thank you so much, Prof, for accepting our invitation to speak with us. And like I mentioned to you in the email, this is the Advancing Women's Economic Power Community of Practice. And it's a privilege to have a professional every month come to teach us and let us learn. I learned something recently, and it stuck with me for a very long time, that mentorship is the shortcut to success. Yes, they say there's no shortcut to success, but if someone who has gone before you can just show you the ropes, then it's easier for you to achieve what you want. And it's a delight that you're here with us to show us the ropes. So I would pause and let you take over from here. Thank you so much.
Yeah, thank you so much, Success, for that lovely introduction. And for me, it's always a pleasure just honoring your requests. And today I'm happy to just talk about monitoring and evaluation, which is definitely a roadmap to any project success. But then I'll be able to take the financial bit, which I'm going to stress more, so that especially for those of you who are not good in finance or accounting, you can be able to just know how to integrate the two. So looking at how I had planned my what is it called, my presentation, I'll be able to just take you through. I have a very structured way of just showing how I want us to go through. So let me see if I'll be, yeah, good. Okay, so yeah, good. Yeah, so from the introduction, Success has mentioned that I'm more inclined to accounting and finance, and being the leader of the accountancy profession in Kenya, this is something that I am so passionate about and something that I do on a day-to-day basis. So it is my privilege to take you through this session so that since I've been informed all of you have gotten grants, this is actually going to be very instrumental in terms of ensuring that you and the donor are going to be good friends and to increase your chances of getting even a higher grant as you scale up the activities that you're doing. And when I was listening to, I think, Precious, when she was talking about her project, I'm really happy that it is something that is serving the community. And basically, that's what most projects that get donor funding should actually be aiming. So I wish you all the best. And I'm hoping that whatever we'll share today will be of use and of help to you. So in terms of what our learning outcome for today's session is going to be, one, I wanted you to just understand what monitoring and evaluation is and why it matters, and then to just have a good difference between the monitoring and evaluation. And then we look also at the foundational concepts like the logic framework or the logic model, because for you to be able to just monitor either the finances and even to evaluate your project from the finance bit, you need to have a way of thinking that is logical, that will help you to know this is where I'm going and this is where I'm going. And then my focus is going to be the link between M&E and finance. And I'm going to stress most of the time there. And then I'll just talk about smart indicators, because in any model, you need to clearly and smartly state what you'll be using to measure your performance. So I'll just stress on what is smart, so that it's going to be a good guidance. And then I'll also look at the models that are there. So I'll not go so much into the depth of the models. I'll mention what they are, but I'll also encourage you to find out more about them. One of these models, and this is the theory of change, because it brings a lot of logic when it comes to M&E. And especially now for the projects, even though most of you didn't mention what you are doing, you'll be able to see when you understand the theory of change, you'll be able to very clearly even believe in whatever you are doing. And then I'll mention the tools that you can use, the pitfalls that are there and how you can avoid them, and then an action plan on the way forward. So basically, that's how I've organized my presentation. And then now in terms, so those were in terms of if you look at what I have, these are the learning outcomes. So by the time we are done, what should you have known? And it is good. I normally like starting with the learning outcomes, because after we are done, you now need to go back and check, did I really meet like my learning outcomes? And then in terms of the presentation overview, this is how it's going to be, but it's basically going to be guided by the outcomes. So we can start with what monitoring and evaluation is all about. And you are free to interject. You are free to just put your points on chat so that I can be picking them. So whenever you are doing anything, it is important for you, one, to know what you are doing, to be able to track what you are doing so that you can be able to check whatever you are doing, is it in line with what you are intending to do? And then now also assessing the performance. Now, when we talk about monitoring and evaluation, this is simply just that, tracking and assessing, meaning that you'll be having a checklist to tick. Have I been able to do what I'm supposed to do? Have I been able to achieve what I was intending to achieve by the activities that I'm undertaking? And that's when now when we look at the definition, we can simply say that monitoring and evaluation is a systematic process of tracking and assessing projects' performance to ensure it's achieving its intended goals. So that's a simple statement, but a very loaded statement, because it means that you must have a goal. And we've been talking about goals and how they need to be smart. And then you must have a path that you're going to follow to achieve those goals. And that's why now we have the logic framework that helps you to know and map up all the activities. And then you must have a way of tracking on a continuous basis, and at the end of a period checking whether you have been able to achieve what you needed to achieve. So meaning you must have indicators that are aligned to the goals that will help you to know whether you are doing well. And when it comes to M&D, we normally say that if you are not checking, if you are not planning, then that mess is actually going to be revealed in the outcome of your results. And you might be very busy as you try to undertake the project. But since you don't have a system that is systematic, you can actually reach the end and then you discover all the goals that you intended actually have not been achieved. And that's why when I'm looking at the cartoon that I put there to start us off, you can see we have two people and there's a lot of information there. So the guy who is collecting the information is telling the other person, just get all the information you can, we'll think of a use for it later. No, in M&E, we cannot be like that. We have to be very objective. Every information that we search, we should actually have planned for it before we began. So that is what M&E is all about. And since most of when Precious was speaking, she said that she's actually in the initial phases, the implementation bits, then she needs to really understand what M&E is all about. And I want to liken M&E to a real case world example so that it can simplify the understanding. So when you talk about M&E, we say that this is like your project's health checkup system. And I'm happy that you are in the, maybe most of you are in the health sector because I've interacted with some of the activities that you do. So it's like a health checkup of the system. And remember, the system is the whole body with all the different organs that are there. So monitoring is like checking your vital signs. So to monitor, it means you go, you check your temperatures, you check your blood pressure, you take all the vitals, and then once you do that, you are able now to evaluate at the end of the period or after you've taken all this, is your body actually healthy? And are there things that you need to correct? So if I can just follow that, I can say this is like checking your vital signs daily, while evaluation is like your annual physical examination that tells you if you are actually healthy and thriving at all. And the link between monitoring and evaluation is that, for example, if you take your temperature and then you find they are not right, then you have to go to another step. That is like the evaluation. So looking at this analogy that I've given, it means therefore that monitoring needs to be done frequently. Remember, you don't go for these physical exams all the time, but whenever you go to the hospital, they'll check your vitals. So that is what is monitoring. It is frequent, and these are indicators that will be able to say whether you are healthy or not. And then if there's going to be some deviations from what is expected, then you need to do a physical examination to confirm whether things are right. So basically, that is what monitoring is all about. Now, looking at it as a researcher, and I know most of you are now undertaking some research. When we talk about M&E, this is what is able to transform the data into decisions. And looking at that cartoon that we had just looked at, where they are collecting data for the sake of it or working backwards. That should not be the case. So when you have when you perform your M&E activities, you are able to make very useful decisions from the information that you have. And we normally say that if you don't have M&E, it's like you're flying blindly with donor money. Remember the money that you got, you wrote a proposal and the donor believed in that proposal. So you need to ensure that you are aligned with what you are supposed to be doing. And then studies have shown that any project that has a robust M&E is 3 times more likely to achieve their objectives and secure future funding. Definitely that means that without M&E, then it means there are projects that actually fails. And the beauty with M&E, why we must do it, is that it protects you. Remember, as a recipient of grant, you need to have credibility. You need to maintain that credibility. Now, M&E is that aspect that will help you to actually provide evidence of the impact of your project. It justifies your budget. If you're having any budget adjustments, then it also justifies, and it demonstrates your credibility. And we normally say that what gets measured gets managed. And looking at what World Bank says, it says that projects with strong M&E had 60% higher success rates in achieving development outcome. And we want you to be part of the 60% or even above so that those figures can go up. Now, there's a very clear difference between monitoring and evaluation. And I had alluded that when I was just saying monitoring is very continuous, it's very frequent, and then evaluation is checking at it overall. Are we where we are supposed to be? So when we talk about monitoring, here we are looking at the journey. And the difference between these, looking at the what, when, and the questions, in monitoring, the what is that we do continuous tracking of the project activities and output. When we are doing evaluation, it is periodic after the end of a period. And I'm hoping that in the projects that you are all undertaking, you have a period when you are going to be doing your monitoring and evaluation. And remember, monitoring is continuous, evaluation is periodic. So is it going to be quarterly? Is it going to be half yearly? Is it going to be at the end of the period, or is it after the period? So when you look at monitoring, the when, you can see daily, weekly, monthly. And for the evaluation, it is more spread, it is midterm, endline, or ex post. Now, in monitoring, the question that you ask is, are we doing things right? And that is why now we took the analogy of taking your vitals, the temperatures, and the rest, those vital examinations you do. So the question in monitoring is, are we doing things right? And in an evaluation, we are looking at, are we doing the right things? You see, and these are very similar words, but just very different from what is the words that are coming faster. So you can see one, are we doing things right? Are we doing the right things? Did we make a difference? So you can see if you are doing monitoring and evaluation, and especially the midterm evaluation, they're able to bring you back to track in case there are changes or in case you are a bit lost. And I've given you examples of what monitoring is. So you can see here in monitoring, we are saying we are tracking the number of beneficiaries reached. We are looking at how much funds have been spent, and we are looking at the training sessions conducted. Now, in evaluation, because this is at the end of the period, because of these beneficiaries, what is maybe the behavior change? We are looking at the funds spent. Have they brought in an income improvement? So you can see a measure evaluation, since it's the destination, we are looking at what has happened because of the activities that you have been mentioning. So UNDP tried to give a difference between the two, where they said monitoring tells you if you are on track, while evaluation tells you if you have arrived at the right place, because any activity will lead to arrival to a destination. But the question is that the right destination? So it's important for us to just be able to have the difference between the two. Now, for you to be able to do M&E properly, you need to have certain foundational knowledge. And this is what we call the logic model or the log frame. Now, when we look at the logic model, this is a framework that is normally very helpful because it is able to track the progress of a project before even you did from the beginning to the end. And it normally has the 5 variables where we are looking at what are you putting in the project. Are you putting in money? Are you putting in resources of human capital? Now, what activities are you going to engage these resources in? That is another item that appears in the logic model. And then what are you expecting to have? What are the outputs? So again, after the outputs, what are the outcomes? And then very important, what is the impact? So when you have such a model, it enables you to be able to know and to break down your project into smaller pieces that will enable you to actually achieve your goal. And an example of a health education project where maybe you want to have some health education, you can say, what inputs are you putting in? You are putting funding, you're putting staff, you're putting in material. What activities are you going to engage in? And they should be very clearly enumerated. One, you'll have training sessions, you'll have community workshops. Those are the activities. Now, out of these activities, what would you want to see physically? 500 people trained. But remember, your intention was not just the training. You have a project maybe that is related to health. So an outcome will be now, you want out of these people you have trained, a certain percentage must be able to adopt a certain behavior. There should be some behavioral change. And this is where you are saying 80% adopt hand washing practices. And if they do that, out of the 500 people, out of the 80% who have adopted this hygienic habit, now you need to look at the impact. And you can see the impact is 40% reduction in waterborne diseases. Now, if you have a framework like this, you can see it is quite logical, and it helps you now to monitor your activities so that you can be able to match the funding and actually the final impact. You are going to match the funding with the activities. You are going to find to match the funding with the output and the outcomes. So basically that you need a framework like that. Now, for you to be able to have a framework like this, there's going to be a lot of finance knowledge and information, because these are figures that you're going to be putting in. You're going to be measuring some of these items, and we are going to look at that. And for me, what I would want to just to leave with you, especially on this slide, is you need to come up with action items. For those of you, depending on where your project is, you must map your project on this logic model today. And I put the today in caps so that if you don't have it, you have it. And then you need to identify smart indicators at each level. You can see, like, for example, A, we are talking about funding. How much do you need? You had to put it down. And for you to have done that, you must have had a budget. Again, in terms of measurable, are you able to measure? And you can see the way I've put my structures. It is very measurable. You can be able to count, and you can be able to check whether you are there. And then looking at the smart, which we'll look at it later, which I'm sure is something you've done. So we are saying you must identify smart indicators at each level. And then realistic, that one is part of the smart. And one thing that I've noticed when it comes to M&E, and in most projects, it lacks a baseline data. So when you are trying to say that, like, for example, here you are saying there's a reduction in waterborne diseases, you must have some baseline data in terms of what is the how rampant are these waterborne diseases. Otherwise, when you say 40%, 40% from what? Okay, so that is very important. You must always have a baseline data. And sometimes we do studies or we get money for projects just to get the baseline data. And then now from there, we can use it now to scale up the study and then see what are the changes. And before I leave this page, I just want you to note that, and this is a warning that has been there, it has been proven by studies, that most projects will fail because they skip the baseline. And this baseline is very important. Like, for example, I think it was Precious. I'm not able to see the names now. When you are saying that you found that, or maybe you have an assumption that the people in the rural areas actually lack knowledge. And that was on a side. Yeah, you are saying that since you are in the primary healthcare area and you are dealing with their infertility issues, you have actually an assumption that these people in the villages or in the rural areas, they don't they are ignored or they are actually excluded in the infertility health or the fertility discussions. And that's why you are coming up with a project like this. So you had some info, but do you have the baseline data to know how many of them are actually having that knowledge, they're accessing that kind of healthcare? And then now, how many do you want to onboard? So the baseline data is very, very important. Now, we had talked about SMART. We all have done this. You'll have the slides, but I just want to give you an example of what is not SMART. Now, if we have these two projects that we have, one talks about improving education. Now, that is not SMART. That is so wide, because when we talk about improving education, if I ask you from what to what, it is not measurable. Is it achievable? We don't even have a time frame. Is it relevant? We are not sure of which kind of education. Is it specific? It is so ambiguous. So you can improve that by saying you want to increase literacy rates among women aged 18 to 35 from 45 to 65% by 20 to 20 by the year 20 to 26. There's some noise from Flavian. Okay, please switch off the mic. Yeah, so that is an example of a SMART objective or SMART indicators. Look at the second example. We are talking about strengthen community capacity. Again, that one is completely out of the SMART variables or the SMART perspective. So this can be improved by saying you'll train 200 community leaders in conflict resolution with 80% demonstrating skills improvement by the end of the project. So that is what SMART indicators are. And remember, this need to be very clear, because this is what you'll be checking. Are we on track in terms of what we want to achieve? And the tip here is that you should always balance qualitative and quantitative data. Give stories to support your data that is numerical in number. So I want to take a pause briefly at that point so that I can check whether are we together. Are we together? And I'll be happy to hear maybe an objective, a SMART indicator from one of the participants. Are we together?
Yes, please.
Yes,
Okay, yeah. So maybe on site, since you are the one who had started telling us about your project, are you able to state for us in a smart way what exactly do you want to do? Onesai, are you there? Yes, I can see you're still there. Onesai?
Yes, I'm still there. Yes, I'm still there, Elizabeth.
Yes.
So you did mention, I won't be able to give you a smart objective at this moment, but why? Because one of the things that you mentioned was that you have to have a baseline. So one of the challenges that we actually have, which is one of the reason, which is part of the objectives of our project, to actually establish records, because the primary issue as well with infertility in my country is that there are no records, because most of the people, because we don't see infertility as a disease, so it's really a challenge. So they are not, it's not a disease that's set apart, and people actually measure like hypertension or diabetes to say how many people actually access services within the hospitals if they are diabetic. So that's not the same with infertility. So that's actually one of the problems that we actually stated when we talked about the proposal. Yeah.
Yes, yeah. So, and I'm hoping that now the way I'm stating my indicators, even for you, you can be able to come up with very clear indicators. And even for you, the first one will be to just get the baseline data in terms of how many people maybe suffer from infertility, how many people are aware,
Yes.
all, so that now you can say, because of the project that you're going to implement or the one you want to scale up, then this is the problem you notice, these are the people you'll train, this is the number of maybe people visiting the fertility clinics out of the people you've trained, and then maybe from there there's going to be maybe improved I don't know how you'll call it, but improved is it, I don't know how reproductive
Okay.
health for
Yes,
them.
yes.
Yeah. For the
So,
community.
okay. So one of our objectives actually, we want to train 15 primary care nurses um, in 1 month. Of implementation of the project, and then we expect them to then 80% of them then demonstrate basic understanding in terms of treating infertility at the primary care level. So the project will end after a year, so it will be 80% demonstrating knowledge improvement in 1 year.
Okay, good. Yeah. So you can see you have that. And then maybe the impact would be, so from a reproductive point, what would happen? Therefore, maybe you'd hope to see increased, maybe people, women and even men coming to the hospital to have their reproductive health checked if they have issues. So there should be that.
Yes.
So after training this, what next? Yeah. So those are some of the things. Yeah. So for the others, I hope you can be able to see that. And I'm also hoping that now, on SI, you can be able to smarten whatever you are doing, especially getting the indicators that you'll be using for monitoring and evaluation, because that will really help you to just track. And if you use the logic framework, it will really assist on the M&E side, because you've already done the project, but now the M&E is going to be an issue that needs to be checked on a different level. Are we together, the rest of the ladies who have joined? Ladies, are we together? You
Yes,
can
we
even
are.
yeah,
Yeah.
perfect. Yeah, thank you. Yeah, you can even use the emojis, the chats there. Yeah, so now we can, I want now to look at the critical link between M&E and finance. And for me, this is a very pertinent topic because looking at most of the projects, because I also undertake projects, and these days M&E, especially when you get the donor-funded project, they are so keen on M&E, because going also by the data that are given from the World Bank, where we don't monitor well, because we just do projects and then we maybe stop there, or a different body comes now to do the M&E, but that now should be linked, the M&E and training. Now, I want to look at it from a finance side. What is the link? Now, one important link between these two aspects is budget justification and allocation. Now, what you need to know is that if you are not good in finance or accounting, or if you have not put your figures well, you are going to have a lot of problems when it comes to budget justification and allocation. And I know for me, the projects I've undertaken, especially the ones with the donors, and especially USAID, you need a lot of notes for your budget. And those are the metrics that will be used to actually evaluate your performance. So make sure that you know how to account for every shilling when you are doing the project. And also now when it comes to the implementation, can you stick to the budget? And this is because M&E data proves how funds are being used effectively. Remember, actually, when you are doing an M&E, you are not even looking at the outcome only. You are looking at the resources that you put in. Have you been able to use them well? Again, in terms of budget allocation and justification, this will help to show the cost per beneficiary. Like Anissa, you're talking about the workers, the primary healthcare who will be trained. So what is the cost of training? What is the cost of maybe in terms of reproductive health that has been saved by this training that is now going to be maybe more, it will encourage people to visit hospitals if maybe they have maybe diseases that cause infertility, how much has been saved. So you can be able to show cost per outcome, cost per beneficiary. Again, budgeting justifies the budget request for future funding cycles. Now, if you do your finances well, you are going to just, in terms of the future, it will be very easy to get more funding, because your finances or your house was in order on the finance side. And then also it identifies areas that need more or less investments. So as you do your M&E, on the resource side, you can actually be able to know that, yes, when you are planning for the project, you had projected and you expected to spend more, but now you spent less. So how can you do and improve that in future? Now, something very critical about finances and M&E, it brings in financial accountability. Now, I know for those of us who do those big projects, you have to track every single item. If it is expenditures, you have to track them and you have to match them with results. So meaning you need very good documentation. And this actually for the donors, it just demonstrates value for money. And it links the spending and it links the funds that you have to the outputs and to the outcomes. And then also it gives evidence for financial reporting requirement. So if you have grants that are from the big lending organizations or big development agencies, you'll find that for them, the evidence and the justification even for the next month's pay, you need a lot of information on finance, very proper record keeping. And the beauty with this organization is that they give you a template, they tell you what you need to do, and they have experts who are in that area. So when their team comes to audit or to monitor, you find things very easy. And then adaptive budget management. Remember, when you are putting your figures well, it means that your budget is not a static document. A budget is a plan and it can change. So by proper record keeping, you're able to know how you can adapt your budget to fit in the realities on the ground when you are undertaking your project. So we say that M&E, the findings can trigger budget reallocations. So as you start implementing, you'll actually see what you had planned. Maybe you had over or underestimated. Again, you'll find that if an activity isn't working, M&E will clearly show that this is not working, and it can even guide you in abandoning that and looking for more effective interventions. And then it also allows mid-course correction before money is used. So I'm looking at it from the finance side. If you are able to manage your finances well, the project will definitely be able to progress well. If there are any problems in between, that is going to come out very strongly. Again, your performance from the finance side will actually be a determinant of your future funding decisions. And we normally say, if you have strong M&D data, this puts you at a very high chance of securing additional funding. And I'm sure for most of you, you've all received the funding, you'll agree with me that whatever you got is not enough for what you wanted to do. Or if you are collecting baseline data, you want to scale your project upwards. Now, for you to do that, then proper financial management and the data that you have will actually support, will be evidence to the donor that you can, that you are actually the right person, you are accountable, and you can get the additional funding. And then we also say that donors fund projects that can prove impact. So how will you prove the impact? How will you even be able to say this is the cost per activity? So if I want to train 100 people after scaling up, what was the cost of training one when you are doing the baseline? So this now can help you match the impact and the funds. And then we always say past performance data influences future grant approvals. And that's why sometimes when you're applying for a grant, they'll ask you, have you ever been successful before? What was the value of the grant? And they're going to check what was the performance, what were the outputs of that grant that you had received. And from a statistic point, we say that projects with a robust M&E, and I'd said this, are 3 more times likely to secure continued. In fact, we had said they are in terms of success, but now here we are saying they are 3 times more likely to secure additional funding. Now, another link between M&E and finance is the issue of cost effectiveness analysis. So you are able to calculate accurately and with evidence. You are able to calculate cost per output. And for me, this is very important because looking at most projects, they don't compute this, but these are things that you can compute. And you can see how we are saying an example is $50 per person trained. So in future, if you want to train 100, you can either multiply or you say the first 50, they will cost this, the next 20, the next 30, that way. So, but at least you have some figure as you try to apply for more funding. Again, cost per outcome, shillings $200 per person who change behavior. So you can see one is an output, the other one is an outcome. And then now for the donors, it is able to clearly show them the return on investment on the funds that they give you. Another link between M&E and finance is financial risk management. Now, when you put down your project, your proposal, you are doing it now, but you're planning for the future. The future is never certain. Things will never be so linear that whatever you had projected is what is going to happen. And this is where the issue of risk management comes in. Now, so from a risk pointer, by M&E and from the financial side, you are able to, it gives you an early warning system. So M&E will flag underperforming activities before budgets are depleted. You can imagine if you didn't have the finance side, and then you use the resources thereof, and then you start saying, oh, by they have not done so many things, but I've already exhausted the budget. Now, the finance bit on M&E is able to give you early warning signs, so you'll be able to avoid overspending, and especially on effective strategies and do adaptation to move to the next one. Again, it also protects against audit findings by maintaining evidence or audit trail. Personally, I'm an auditor also. So when we are collecting evidence, we have something that we call the audit trail. We want to see, when you put in this shilling, which you are documented, can I see the documents that supported this? Was the shilling used for whatever it was intended? So by having all this information right, you are able to actually track that, and it helps you to be able to just have a clean audit trail and to get future fundings. Again, the link between M&A and finance is that it brings in that budget transparency. So M&E reports show stakeholders exactly what their money achieved. Remember, a proposal is requesting for resources. So, and most of the resources come in form of money. So the M&E and the finance beta and proper record keeping will be able to just show your stakeholders where their money went and what their money achieved, because it links every single dollar with tangible results. And then from here, donor build confidence and trust. And you'll note that there are people who are always getting funding. It is because of their past, which is clean, because of their accountability that enables them to get more grants and funding. So the key principle when it comes now to M&E and finance is that if you have no results, then there'll be no more funding. Therefore, we normally say that M&E is the bridge that connects financial inputs to development outcomes. And it answers the critical donor question: where did we get for our money? And even for you as the researcher, it helps you answer, where did the money go? And did it meet the goals and the outcomes that it was intended? So I would like to pause there briefly for a minute, and I can see time is really spent. Any question up to there so far? Isabel, are you able to say something? Because your mic is on, but you're not able to speak. Any question? Are we together? Are we together? I can see we are 13. Those who
Yes,
joined late, have you been able to follow?
yes, ma'am.
Okay, thank you. And the ones who are so silent, I'm actually concerned. Good, I can see Phoebe has put a heart. Catherine, a joke, are we together?
Yes, we are together.
Good, thank you. So actually, for me, actually that's the part that I really wanted to emphasize on, the part of finance. So the next part I would want us to go with, I'll browse very fast because of time, and I'd also want you to ask question is, what you need to know is that we have models that you can use to successfully monitor your projects. And normally these models that are there, they have been tried and tested, and they work best in certain specific situations. And some of these models also, they are used by certain bodies more than others. So what I've given you here is just the different models, which I might want to skip because I would want you to maybe learn more about them. So we have these models. My focus was really so much on the finance, but what you need to know is that all this I've put in form. We have the resource-based management, and this one, why it works, it is able to look at what you put in versus now the benefits that are out. So I'd want you to read more about that. And then we have also some models that want to look at what is the most significant change, and you can see who uses them, what are the key features, and why it works best. And we say this one, it works best because it captures unexpected impacts and gives voice to the beneficiary. So this one is more on storytelling, and it wants to pick what is the most important change. And we normally say when you are using this model, we say numbers will tell you what changed. Stories will tell you what it meant. And for the meaning is very important. So like what Onesa is doing, if they could hear stories of these women saying, or these men saying that I used to have a problem, but I didn't know, or I didn't know where to go, but now I've been able to get assistance. Maybe I have a child, I'm so happy. That's a very impactful story than saying one woman was assisted. That story is more impactful. Okay. And then we have outcome mapping. So again, this is a kind of model for M&E that is used by the organizations that have made, and it's normally used for projects that have very complex social issues. So like, for example, this would be, it is perfect for projects where you influence, but you don't control the outcomes. Like if it is advocacy, like for me, I'm in the advocacy space as the chairman of the Institute of Accountants in Kenya. So we do a lot of advocacy, we engage government bodies, we write position papers, but we cannot force the government to actually implement the recommendations that we have. So because of maybe it has political implication, but now the beauty with this is that we are just looking at the outcome. So in terms of our advocacy, where did we reach? How many partners have we met? How is the traction of whatever we are doing? So that is what is referred to under this model. And then we have the theory of change. This is a very helpful model because for any project that we do, we are hoping to have a change. So it helps us to check what is the rationale for the change. How will it happen? Why is it happening? So it's a very powerful model, and I would want you to just maybe understand. I don't know that you've already engaged with this, but it's a very, very impactful model. And why it works, we say it forces you to think how and why your project will create change. And the beauty about this, you start with the change. What are you envisaging? Like, for example, in the case of Vonesai, what do you want to see? So you start from the end. What is the outcome? And then now you say, this is the outcome. Therefore, how will I achieve that outcome? So it tells you what you want and therefore how you are going to get it. So when it gives you the why, and starting from the back and now trickling downwards, it actually gives you a very impactful way of trying to monitor your performance and your success. So when it comes to monitoring and evaluation, we have different tools that you can use. You have the tracking tables, you have a data collection plan, you have your calendar, you have a dashboard that will give you the key indicators in pictorial forms, you have the learning logs, what have you learned. So those are the tools you can use. And then also we have the data collection methods that you use to do your M&E. And then I would want us to go to common pitfalls as I wrap up. what should you avoid so that you don't get into challenges in M&E? One, remember I talked about smart indicators. Now, for any project that you do, don't have too many indicators. If there are too many, it will be so much work for you. And this is actually going to put you into problems. So emphasize more on quality over quantity. 10 to 15 indicators enough. Anything above that is too much. Another mistake, and I'd mentioned this, if you have no baseline data, if you don't know what was there, how will you know that a change has occurred? So first collect baseline data. And this one is with no exception. So for those of you who are yet to start, make sure you have the baseline data. Again, another mistake is some people, when they're doing their projects, they have no plan for M&E. It comes in after as an afterthought. Remember, we said monitoring is continuous, and then the evaluation is at the end of a certain period. Now, you can imagine if you are not monitoring, you are just moving on. That will be totally wrong. Another problem that, or a pitfall that is there, is data collection without analysis. Now, once you collect the data on your M&E, you must analyze it. And you can see here we are saying data unused is data wasted. Like our friend there in the cartoon, just collect as much data and then we'll get use for it. That should not be the case. And then finally, a common mistake is there's no feedback. You must share your findings of the M&E with beneficiaries and adjust the program if need will be. Okay, so just note that M&E is not to prove, but to improve. So the purpose of M&E is not to prove, but to improve. So what are our key takeaways? You should always know that M&E is strategic and not administrative. You should start with very clear logic, and I give you the logic model, all the way to the different models to the theory of change. When you're doing your M&E, keep it simple. Just make sure quality over quantity. Make it participatory. Don't keep it to yourself. You need feedback. Use data regularly so that you can be able to change. And then tell the story. Don't just put it in figures. So combine numbers and narratives. So as I wrap up, one, there's a guideline on the things that you need to do. So you can draft your logic framework. The one I've given you can also now come up with your theory of change. You need to list your smart indicators. For those of you who don't have, you budget 7 to 10% of the funds for your project for M&E. And especially for projects where you're supposed to do the M&E, not projects where you'll have an external person who has been contracted to do the M&E, and then assign an M&E a focal point. And always remember that good M&E isn't extra work. It simply makes your work count. So with that, I would want you to reflect on the, sorry. With that, I'd want you to reflect on this. So one, ask yourself, what story do you want your data to tell? So that as you're collecting data for M&L, what do you want it to tell? The other question you need to ask yourself and reflect is, how will you know if you have succeeded? And finally, what evidence will convince donors to fund you again? So when you ask yourself these questions and you implement what I have mentioned, I'm sure you'll be the best receiver of grants in the years to come. So with that, I thank you so much for listening. I know it's an evening if you are in areas within the 3 hours GMT, and it's a weekend, but I wish you all the best and thank you for your time. So I will open for any questions. Success, you can take it up from there. Maybe help me to see how you guys do your Q&A, but I'll be very happy to take in questions. And you can also guide us on the time, Success. Huh?
Okay. Thank you so much, Prof. We're actually 5 minutes above the time, but I just want to say thank you. I really learned a lot today. In the past, I did the project on cervical cancer screening, and basically my M&E was majorly numbers. I didn't really know that there are different models to it, that storytelling is also M&E. You know, I had always looked at monitoring and evaluation to be the number aspect, like how many beneficiaries were impacted, how many trainings were conducted, majorly the numbers. So, but this session has made me understand that it goes beyond numbers. We have the storytelling, we have the theory of change, we have evidence that can, show impact aside numbers. So anyone can just unmute and share something new you learned, or if you have a question, please kindly share before we call it a day. Thank you.
Thank you, Prof. For me, this was really insightful. The different models that you've shared made me see M&E in a totally new way, because I think how you even explain the theory of change to say you're starting from the outcome and then working backwards to what you are supposed to track so that you can get to the outcome that you want. Because I think in general, we're so used to the results based where we are saying, let's just see what we get, but not even aligned to the outcomes that you're expecting. So thank you so very much. For me, really insightful. You just, in this 1 hour, you made M&E so simple and easy, to implement. And this is really going to change my projects, not just the one for the grant, but even my work. So thank you very much, Prof.
Okay, thank you
enjoyed.
so much, yeah, thank you so much, Onesai, for that. And thanks for allowing us to use you as the example, because you're the one who told us what you're doing. Yeah, so thank you, and I wish you all the best in your study. Yeah,
Thank
so I
you
can
very
see
much.
it's coming online. I appreciate, and I would be happy if you are able to implement and improve whatever you're doing. Yes, to you, success.
Thank you very much, Elizabeth. So I'm seeing the chat, and I think people are more comfortable with, using the chat. Onizai seems to be the boldest person on the call after Precious. So thank you all so much for being here. We really appreciate your engagement, and thank you for letting Prof know how insightful this session has been too. So we understand your time, and I don't know if we have any more questions. If we don't have any questions again, I think we can call it a day. Phoebe, would you like to share any announcements?
Hi, Success. Hi, everyone. Thank you so much, Professor. That was very informative. So announcements, December, we have a special session in December. So please do sign up when we send out the link. We're going to have a vision board party. So instead of the normal goal setting for next year, we thought we should make it a bit more fun. So come prepared with the goals for 2026, and then our speaker will just take us through how to create a vision board for yourself for 2026 and beyond. So I hope you are excited as I am, and you'll sign up when we do send out the link. Thank you, Success.
Thank you so much, Phoebe. I really look forward to that vision board party. So I get set up for the next year. Okay. Thank you very much, Elizabeth, for your time. It's such an honor to host you today on this community of practice session. We really learned a lot. We really appreciate you.
Thank you. Yes, so and maybe just some advice, because I've been in groups of community of practice, community of conscience. Actually, it's more about sharing. So as you have more of these sessions, there should be more of sharing and learning from each other. Yeah, so the participants feel free to speak, to share your experiences, because that's what actually a community of practice is all about. Thank you. Yeah, it was my pleasure.
Thank you so much. Bye, everyone.
Okay, bye-bye all. Have a lovely
Bye.
evening. Yes, you can reach me out on email so Success can share my details. Bye all. All right. Good evening, all of you.
Good evening. Bye.
Bye.